people online. I don't know what you can see, but you are very welcome.
They can see the room.
Okay.
Here's the camera right
okay,
here.
cool. There's 5 of you. Nice. Okay, so I'm Marnie Somer. I'm a professor at the School of Public Health, and you will meet April and Anvesh. I'll let them introduce themselves. So we're going to get started right away, just because we overly plan the session. You don't have to stay the whole time, but we have lots of breakout and things you can do, and we really want everyone who's here to go back to wherever you came from and do a menstrual-friendly public toilet audit if you are so inclined. So you may know how to do it by the time you leave. So I'm going to dive right in. What does it take to get started to really understand?
Maybe click on the slides once.
Good idea. Yeah, maybe I'll just do this. There we go. I'll just use this. Okay, so what we plan to talk about today is introduce you super briefly to the concept of a menstrual-friendly public toilet and the toolkit. We're not going to spend a lot of time on this, but my team at Columbia University designed it, and we're happy to answer questions. We have a lot more resources. We just didn't want to use today to be like, this is what it is. We did that last year. And then we're going to have 2 case studies of folks who did related work in 2 different parts of the world, in 2 different cities, so you can learn what they did and what they learned, which is great. And then we'll have a breakout just to talk about sort of getting started and implementation and advocacy questions around using this wherever you came from. If there's time, my team with our colleagues around the world did a Menstruation on the Move storytelling campaign just to capture some like lived experiences, which is really easy to do. And similarly, I hope you will go home and do something similar. And then again, number 5, we're really not sure we'll have time for, but we may, sort of a starter kit on how you go back home and do this, and then a bit of a wrap up. So again, no pressure to stay, but we hope you will. Okay, so, oh great. Ethiopia is with us. I love that. Hello. Okay, so just very quickly, menstrual-friendly public toilets, an overview and introduction. You'll see all the logos at the bottom. This was done with colleagues around the world. I think I took out the slide because we had too many slides. But we had New York City, Barcelona, colleagues in New York City, Barcelona, Osaka, Kampala, Manila, and Rio de Janeiro, because we really wanted to capture experiences in cities all over the world. Okay, so objectives, just introducing the concept, the different components of the toolkit, so you'll be familiar with them, and then how we tried to do some sharing back and advocacy. So why did we decide to do a menstrual-friendly public toilet study? We had a lot of you maybe work on sanitation already, but we were sort of aware that there was this growing global menstrual movement, as one might call it, but a real focus on products, which are important, but a lot less on some of the other components, including toilets, which are the least sexy topic on the planet, even though everyone at this conference loves toilets. And that in turn obviously impacts gendered access to the public space. And then that sort of led us to think about, although we had been thinking about this for a number of years in different iterations, this concept of a menstrual-friendly public toilet. And so we did this 6-city global study, the cities that I mentioned, and designed a toolkit exactly so that we could get other people to replicate what we did. So just, I already mentioned it, but these were the 6 cities. We had a lot of debate about should we do only high income, should we do only low income, and then we thought, you know what? We bet no city in the world has menstrual-friendly public toilets, really? So we'll just show that and make that point as an advocacy point. So what is it and who is it for? So it's this set of tools that we designed so you can go around wherever you live and assess how menstrual-friendly the public toilets are in your environment or context, including, which is why we do the interviews, barriers and opportunities to potentially create them or make them more available. Also, it's a way to build evidence for advocacy because you are capturing some data and some insights into why they don't exist and what they look like and, frankly, how terrible public toilets are in many parts of the world, including my city, New York. It's for really anyone. More rigorous scientists can do it and use it the way we did it. Citizen scientists can do it, advocates, implementers, students. We had students help us. You'll hear about that more today. But you do want to adapt it and use it to meet your needs. We adapted it a little to make sure the folks in Osaka were asking the same things we were asking, that it all fit with what they expected to see. And then what is included? And, okay, Ghana is with us too. I love this. Okay, what is included? There's an overarching guidance note. There's a toilet audit tool, which is a very long checklist, which you can sort of use on an iPad or a phone or paper. There's a training deck. Oh, great. And we have some printout copies. You can see what it looks like. We don't have enough for everybody, but you can kind of maybe just pass them around. A key informant guide, and then examples for how to sort of disseminate the findings on our website. Again, Bree overview, all the pieces I just said, how to get started, how to do an audit, considerations for your interviews, a fax piece of content, and then these 4 appendices. One is just a graphics, because we realized in most cities nobody knows what we're talking about, so we decided we needed to mock up what we thought a menstrual-friendly public toilet looked like. Definitions that you may need. If you end up doing kind of the spatial analysis that we did, there's guidance in there, and then also how to do more rigorous and less rigorous data analysis, so you can sort of showcase what you find. There are the toolkit components. Just the most important one to flag is we do have a training deck on our website. And also we did a webinar on sort of how to use it. So, but my team is very available if you have questions. Here's just this is our mock-up, although there's a lot more in the guidance note itself, but just to say, you basically want everything you would want in a basic, clean, solid toilet, and then you add some components. But all of that to us is part of what a menstrual-friendly public toilet would, but obviously disposal, a shelf, a hook, a long enough mirror, products, ideally free or low cost, and so on. When you get started in a new place, you want to find key stakeholders. Who do you want to interview? Who might be able to tell you how things work in that city and what the possibilities or barriers may be? So that's just a list of the kind of folks you might want to talk to. Eventually, you'll narrow down your list to the 5 or 10 folks you actually have time to interview. You can always do something bigger, but we kept it relatively small. And you'll do the key informant interviews, because they really give you the insight about why they don't exist and what's possible. And then in terms of using the toilet audit tool, it's very long. I just have 3 slides, I think, to show you, to give you a sense of kind of how it works. This was just when you're thinking about kind of doing the spatial, sort of, we picked 4 parts of each city: business, residential, tourist, and a transit station, so that the 6 cities had comparable 4 sites. And then we mapped sort of a barrier, a sort of circumference around them that our student teams walked and looked for public toilets and assessed them. So we have guidance on how to do that if you want to do it that way. Here's just an example. We have a lot of pictures in our training deck to help all the students, or whoever the team is, be in the same place when they're assessing cleanliness. So here's just an example of sort of a section that tries to get at how clean it is, because if you don't have a clean toilet, even though that's obviously a basic sanitation thing, it's not going to be menstrual friendly. So poor, adequate, and good is just, again, a way to sort of help everybody be on the same page. Similarly, here gets into the section on menstrual management, making sure the mirror is long enough to see stains. One of the teams, or a couple teams, wanted a changing table so that a woman, or if it's a woman's toilet, would be able to put the baby down to change, obviously, when they have their period. And then, this is very slow, there we go. And then, ideally, some kind of availability of menstrual products. In terms of visualizing the data, I'm not going to get into this today, but we had an MFPT index score that each city got rated on. There's different ways that you can showcase it. The team put one in Canva and one in Excel, just so you could showcase, because people like to see numbers. And then ultimately what we did is we had webinars or in-person meetings in each of the 6 cities to feedback findings to any stakeholders who were interested. We came up with these fact sheets, which are on our website if you want to mock up similar ones, to say what we did, what we learned, what we recommend in that city. And then we just sort of are doing presentations as people are interested, and so on. We were going to do New York, but then it looked like our mayor was going to jail, but then he didn't go to jail. So we're just waiting for the new mayor, and then, which the election is next week, and then we'll tackle New York again. Okay, all right, over to April.
What an ending.
Thank you, Marnie, and thank you all for being here this morning. Hi, Kelly. I'm going to talk about how we adapted the original MFPT toolkit and project and implemented it in Atlanta, Georgia. In our approach, we were really thinking about public bathrooms as a public good, and wanted to assess the availability and accessibility in Atlanta. And we really expanded beyond Marnie's original project in thinking about what defines a public toilet. So in their project, they really thought about traditional public toilets that are at least partially funded by either a federal, state, local, or city kind of government entity. But we know that in the US especially, there is greater reliance on private commercial facilities as de facto public toilets. So as we're moving through public spaces, we often know that we can go to the grocery store and, sneak into the bathroom even if we're not picking up groceries, or into a gas station. And those have really become more and more popular in the US as private pay toilets have been phased out. There is actually a really interesting podcast I'm happy to share if anybody is interested, that's where all the public toilets went in the US. And it talks about this example from the 1970s, where there were these students who actually advocated that paid toilets were bad, and that is when in the US all the paid toilets started to go away. And so we have really disinvested in traditional public toilets, and we haven't really replaced them with anything, which really brings issues of discrimination, and we've seen this a lot in the US. And so we've expanded in Atlanta to look not just at traditional public toilets, but also these common private toilets that we know that people use kind of all over the place. So to do that, we conducted field-based audits using the MFPT audit toolkit. And again, our goal was to assess the availability, accessibility, and characteristics. This is Atlanta in kind of the north part of Georgia in the southeast of the US. And while we were doing these audits, we also made sure that we categorized these, whether they were government funded or if they were commonly used private facilities. And I have some examples of each of those that I'll show in just a second. I'll also note that while we were looking at menstrual friendliness, we also decided to actually expand to include men's restrooms. So the original audits looked at those bathrooms that were intended for women, gender neutral, and family restrooms, and we decided to also include men's restrooms. One, just to see, we know that there are a lot of different aspects of gender, especially in the US, and people use a lot of different types of toilets, but we also capture a lot of information beyond menstrual friendliness. For example, things related to baby changing tables, and we wanted to see what those features looked like in men's restrooms as part of this project. Not surprisingly, there aren't many baby changing tables in men's restrooms. So anyway, we picked 15 different areas across Atlanta, and so these blue circles are the areas that we audited. This is the downtown part of the city, just for reference. And the orangish reddish dots are the different locations that ultimately that were eligible to be audited. The areas are 500-meter radii that are meant to show the distance someone could walk if you were in that space to access a bathroom. And we picked these locations based on high pedestrian traffic areas. So are there tourist destinations? Are there college campuses? As well as people who are experiencing houselessness, knowing that if you don't have a home, of course, you're going to be relying on public facilities almost all of the time, right? Because you don't have a bathroom or a private residence. So our government-funded bathrooms, and this is not exhaustive, but just some examples, would be toilets that are in parks, in public libraries, transit stations, public universities was a big one. And then privately funded ones were things like in gas stations, national food and coffee chains, hospitals and clinics. And these privately funded ones, again, we selected based on things that we know would be generalizable across cities, right? I think we all, at some point, probably have tried to at least or have successfully used bathrooms in these spaces. So our sampling strategy, so we have our audit area for our 500-meter radius. And then, as I mentioned, those red or orange dots were the eligible locations. And then within locations, we would audit at least one type of bathroom if it was available. So that means that, for example, if there was a men's and a women's restroom at a location, we would audit both of those. Or if there was gender neutral or a family restroom, men and women, we would audit all three of those. And so basically here we have the audit site, and then we have locations nested within that, and then facilities nested within the locations. Oh, in some cases, I should mention, there was an eligible location where the toilet was not auditable, like none of them were, and that could be that there was a customers only sign, so indicating that that's not open to the public generally. It was locked, or the building was under construction, and we encountered that a lot. And just to get, I think Marnie kind of alluded to some of this, but just to get into the nitty-gritty of kind of what this looks like. We had specifically groups of 2 or 3 auditors that would work together. We had a lovely PhD student, Brandy, who's in the audience, who really kind of led this work, and then we had a group of Masters of Public Health students who were the actual auditors most of the time, and we paired them usually with one man and one woman. That way they had no issues going into the bathrooms in case people were upset that we were auditing the bathrooms. And they walked around with their phones and essentially would complete one of these what we called metadata forms at each location, which just captured what's the location name, what's the category, what's the accessibility of the building, do you have to pay to enter it? For example, if it's public transit, do you have to, swipe your transit card to get in? And then after they completed that, they would split up and complete a separate audit form for each of the different facilities. And so on average, and I think especially the metadata form is probably inflated because they probably had it open before they would actually be at the location. But I think on average, and Brandy can correct me if I'm wrong, it took about 15 minutes per site for us to complete the audits. So moving on to kind of what we collected in addition, and how we adapted the tool. In addition to the original MFPT toolkit, we decided to add some questions that are specific to the Atlanta and the US context to make this more robust, especially as we were adding other toilets, and we had some additional aims that were kind of outside of the scope of the MFPT project. So we added some information, we added about 20 questions, but we added some stuff about general access, knowing that there are a lot of signs and kind of deterring factors in the US of going into especially private toilets that are actually kind of public goods at this point. And so we captured information about signs that are, saying that people aren't supposed to be there, or, no shaving, bathing, or laundering. The image on the upper left is a timed toilet, so the door will open after 10 minutes. Which to me is a little alarming. I don't want the door to automatically open. So we documented things like that. We also added some information about accessibility. So we noticed that there are a lot of buttons that automatically open the door, but a lot of them don't work. And so we added that question to be able to document that. We added things related to stigma, such as, no shaving, bathing, or laundering, where they're trying to deter people from, cleaning themselves, and these other ones. The last one I'll note is that we, the original MFPT toolkit asked about soap specifically, and we were seeing that there were a lot of bathrooms that had hand sanitizer as well, so we added that question to specifically capture that. And I think this is my last slide. So just so you all know a little bit of what we learned, and if you're interested in learning more, we have a poster tomorrow night during the poster session with more of our results. But We found across the city 262 locations, but actually only slightly over half, or excuse me, over half of those locations were actually closed to the public. So not many of the publicly available toilets were actually available. And again, that's because of signs, being under construction, or just being closed altogether. We saw that across these different locations, toilet density really varied. So there's a lot of spatial inequity depending on where you're at in the city of how many toilets you might be able to actually access. And I'll note that the radius with most of the dots is downtown Atlanta, which is actually Georgia State University's campus where I'm a professor. And so most of those toilets are actually university toilets, and a lot of people aren't going to necessarily walk off the street to use those bathrooms, but technically you're allowed to. And so that had the densest number of toilets, but again is a little bit of a weird situation. And then the last thing I'll note is that we saw that largely government bathrooms were larger on average, those that were government funded, and they also were usually better equipped with things like toilet paper, soap, and other amenities. But private bathrooms were more likely to be single occupancy, so if you like privacy, you could kind of go with that option. And allow access without having to, go through a gate or some sort of turnstile. So a lot of the government bathrooms, you had to maybe go through security or some sort of, gate to actually get access to them. So definitely trade-offs between those two different types of toilets. So with that, I will hand it over to Anvesh.
Thanks, April. Hi, everyone. Okay, that worked. Good. It's a good sign. Hi, everyone. My name is Anvesh, and I'm here representing Sanitation and Health Rights in India, or SHRI. And we wanted to present, just give you some context about the menstrual hygiene scenario in rural India and how we can potentially apply this MFPT tool, and what are some of the considerations that we have to make when we move some of these things to a more rural context. Before I do that, I just want to give you a very brief 30-second overview of what is it that we do. So essentially, the government in India has invested heavily in the construction of shared sanitation facilities. There's about 600,000 shared sanitation facilities that have been constructed in the country to cater to marginalized communities who don't have access to household facilities because they have space constraints, they are in informal settlements, etc. The problem, however, is that there is a lack of similar investments in the continued operations and maintenance of those facilities. So you would just have these cement structures that are dead in a way. And that's where SHRI comes in. We partner with local governments, district governments, state governments, and then we take over the day-to-day operations, monitoring, and maintenance of these facilities using a digital dashboard. We train professional staff. If you want to learn more, we have another session on the operations and maintenance at 1:30. But essentially, that's what SHRI does. And over time, as we progressed with our goal, we started working in Jharkhand and also Bihar. We've served about 2.5 million people. Over time, SHRI's staff started noticing rags and cloths that were being discarded in the toilet stalls. And upon further inspection, SHRI's staff found that these rags were being used by the local women to cater to their menstrual needs. And so to understand more about what was the local context, what was the need, we conducted local interviews, door-to-door surveys, group discussions, and we had roughly 3 themes that came to light in this context. One was related to more of the social inhibitions, cultural factors. They were uncomfortable purchasing menstrual pads from shopkeepers who were predominantly men, or markets which were predominantly male-oriented. Second was that the menstrual pads were a little expensive, especially for women in very large households where they would need to get multiple packets. So that was a financial hurdle. And then finally, there was a lack of knowledge, experience in understanding the safe use and also especially the disposal of these menstrual pads, which was a knowledge gap. And so Shri conducted a very, very simple intervention as an attempt to make these facilities menstrual friendly. We are currently running about 22 facilities across 2 states in India, and a select few facilities, about 5 to 7 facilities, where some of our very dear women staff have started a menstrual hygiene program in 2024, where these menstrual pads are locally sourced. We have a local supplier who makes these pads, which are biodegradable in nature. And they're sold at a 50% subsidy rate than the market, about 17 cents per packet, which contains about 6 menstrual pads. And finally, Shri's staff conducts frequent awareness campaigns and also similar interventions in terms of surveys or group discussions on to address some of these knowledge gaps. And just to close, and that's Lajwanti, who actually started this program. It was her idea entirely, she was the one who noticed all of this and wanted to bring this program. She wasn't able to make it today, so I'm helping her out. But all in all, we are seeing an increase in the demand. We're seeing women who come to our facilities and are more comfortable in purchasing these pads, and they're seeing the benefits of it. They're telling their family members, and then the network is growing. However, we are finding some issues in the supply of these menstrual pads, especially ones that are biodegradable. Sometimes the machine breaks down. The machine is run by a guy who is treating it as a business, and for him, if the machine breaks down, if it breaks down for 3 weeks, it's fine. I'll fix it whenever I can. So there is still a supply issue, which is also linked, secondly, to the second point of expanding this to other, even non-Shri facilities, which can be predominantly have male staff, and how is it that we can extend these same services, because we're seeing the demand. And finally, we are seeing this huge potential to apply the MFPT tool to assess the menstrual friendliness of these public toilets in these rural contexts, because it is important as we're seeing the demand. But to complement that, we realize, like, having the pads at those facilities might not lead to increased usage. It has to be complemented by the awareness on the safe use of these menstrual pads and the safe disposal of these menstrual pads. So which is why it's important to have these community drives. And finally, as April mentioned, going along the theme of podcasts, April spoke about a podcast. I'm going to give you one as well. I love this podcast. It's called Against the Rules by Michael Lewis, and it asks a very simple question: who plays the referee? And in this case, in these rural contexts, when we say conduct an MFPT to spot check, who does that? Is it somebody from the government? What are their incentives? And understanding that whole system on how is it that you can keep these facilities menstrual friendly sustainability. Thank you so much.
Okay, so I know we haven't been taking time for questions, but it's just because we wanted to make sure you all had a chance to actually, sorry, I should be in front of this with our global colleagues. April is going to lead this session, but how many breakout groups shall we?
2 or 3.
2 or 3, okay. Will you come up here and
Yeah.
decide this? I'll be here to support.
Of course.
Okay, so let me grab these little sheets. So what we're gonna do now is actually give you all a chance to think about how you might apply this
You'll be sharing with this.
in your various contexts. And so we're gonna have breakout rooms, or breakout groups, I should say. I'm used to being on Zoom, clearly. We're gonna have
There's
breakout.
some people on Zoom.
Yeah, that's true. You all are welcome to participate. If online, we'll have a URL for any online participants to work on this digitally. But essentially, we want you all to start thinking about how you might apply this in your context. So we have 5 different questions, but we'll ask you all to rotate to 2 different questions. So pick the ones that feel the most exciting to you, and you'll have about 14 minutes ish at each station. We have 2 options. We do have these flip chart pieces of paper if you want to use them. We weren't sure we were going to have those, so we created an online kind of board for you all to work from. You can either scan the QR code or type in this URL and put little sticky notes on the Canva boards that we've created. So we will...
since we have paper, maybe we just...
Yeah.
Yeah, since we have paper, which we totally wouldn't have, maybe we'll just do it. It's nice for you all to sit together. And we can bring more paper and we can bring pens around and you can just write on that thing.
Yeah, so why don't, for the first session, people pick either group 1, 2, or 3, and then we'll open up the second session will be, let's see,
4 and
groups
5.
4 and 5. That way, because there's not that many people, we can at least make sure you are not sitting alone. So if you all want to pick either group 1, 2, or 3, we have our little post-it notes around, and get started. And for those of you all online, feel free to use the Canva boards and answer any of the questions that you want. And we'll tell you, you don't have to abide by the rules of time online.
And we can do 2 groups. If everybody just wants to be in the same groups, we can just do. I think these are for writing on the.
Oh,
on the
never mind. Yeah.
whiteboard. Yeah.
Oh, thanks. I have some. Thank you.
Okay, you only got 14 minutes. You need to make a decision. So group
1,
1.
2, or 3.
What public toilet currently exists in your context? That's one option. Group 2, who needs to be involved to spark or sustain interest related to MFPTs? And group 3, what are the political and economic barriers to getting started? So just pick 1, 2, 3. And we're timing you. Now you have 12 minutes. Just list, map out.
Perfect. You all need a marker. I think Brandy's bringing you one.
For those of you who are in the chat, it's great to see you all. Feel free to we're doing 1, 2, and 3 right now. So feel free to maybe use the chat box if you want to participate. You could decide.
They could also use the Canva, and I can
Oh
pull it
yeah,
up
you
on
can
my
use the
computer.
Canva as well. April's gonna look at that on her computer. So for the chat group, if folks want to write, if you're with us and not somewhere else, if you have a preference for group 1, 2, or 3 in terms of the topic, or even do a combination, and then we can read out whatever you say if you decide to do something.
I just feel like there's public toilets. In Chicago, there are like toilets go public parks, but there's also like fields at Starbucks. So when I thought was because like that's I feel like they ask restaurant or store that they actually like even more than like employees ask. So. How is this very different? I thought this would be like I didn't know that.
Did you look on time when we started?
I thought you would look. It's currently 2 minutes ago. Right. 3 minutes ago. So I don't think they were let's say 9 o'clock. Okay. This is 9 and 2. Yeah, that's probably true.
Although we only have.
Or are you just trying to do a microphone?
So, what have we done a donor? and we did mesh our original insurance, I mean, as a I mean, people would still say, but what do we do about it? We wouldn't be solving that. But at least we would be,
Okay, this is my idea, this is what I'm working on solve it, but I just need to like finish. In Europe, there are these programs for businesses where the government pays businesses to open up their businesses, like a small stipend.
well, New York has those are zoning, like if you allow them to use your bathrooms. There's a pilot program, but I don't think restaurants need it here in New York, but yes. So you're gonna put that in as a recommendation?
Yeah, I'm trying to argue, especially with like the World Cup coming, that like, there's gonna be so many people and there's no bathroom fees.
Well, like
And like
LA.
government or businesses have no incentive, and the price, like the cost savings are just like as far as like building a new public toilet versus like getting existing ones just being open and stocked with things. It's like, I feel like a solid argument.
Yeah, I 100%.
Or like,
But you need to publish it soon because they
I
need
know.
to get ready.
I know.
Do you know people in the administration?
I do, and I'm working with business association in downtown that,
Yeah, no.
You know what I meant?
they have so much power.
They're gonna roll out.
I've never seen that in Michigan.
Yeah, I have it drafted, it's just like, I don't like,
800 words.
I don't like the version.
Oh, can you ask someone in the comments office to help tweak it?
Yeah, I'm actually, so I, well, on this agents of change program thing, that I was a fellow, now there's a senior fellow residence thing that I'm doing.
Oh, cool.
Part of that.
People in range 10 or more people up to this downtown area.
Okay.
But I've already pitched it, I just
Oh,
need to
good.
finish it.
Okay, it's just 800 words beyond what exists publicly. It's
Um,
very likely that those people will be granted access to.
What are other solutions?
Funded restrooms, which is very good.
I know,
Oh, you saw.
But
They
what we
would
hear from privately funded, there's places that, people go in there, especially people that
multitask.
really need the facility.
Yeah, I don't have a
They
great solution
there,
there.
so it makes it fancier, or they're doing, like, using more of the resources. We were really doing that housing for those private businesses, are there ways to support them? So if we know that people need this, what can we do to support? Like, is there a voucher where you allow people to use it and then you get some resources?
Yeah.
Because
One,
we're not going to build a
yeah, it's got a really weird name.
title is hard. But I'm sure that's probably the one that has the title.
I think in some other states.
Even the question of like, well, I mean, I think they're gonna be putting out those, porta potties.
I mean, like, I feel like small. Well, I mean, yes,
Oh,
I'm
yeah,
saying
yeah,
like
They're
New
those are
York,
likely.
Yeah,
non-Atlanta, like stuff
Hold your breath, try not to touch anything. Don't sit down, prepare your, sort of the paper.
Especially smaller states. Maine has weird.
I want to see no surprise.
I think in our work too, the university.
So we're almost at the 14-minute mark.
Atlanta University complex, which is Clark's.
No, we're not.
I'm wrong. We're not even at zero.
Yeah, I think, so they really sort of influenced our,
And this is something
I
that
do get a lot of things. Not as specific.
Oh, we're running this way.
like, you look for a place to run around, and then we're like, oh, you can go and try and do that. I think we want to go to
Yeah. And because it's so small, I think we could get through Yeah, I think more people do.
I feel like I've heard of yours.
Yeah, they may also.
No, I think university, I mean, like, in our context, we feel like.
Are you almost done or do you need a lot more time?
Yeah, I think we're almost there.
Another 30 seconds maybe? Another minute? Okay, another minute.
1 minute.
Okay. Sorry, we never had good. I'm sorry. Yeah, I just someone else to make the best figure that I got.
No.
I always think, I'm always trying to tell you. Well, you just need to hang out with Bethany and
Anyway, thank you. But and do more of what
So with your, public
Okay, we'll announce it. And then we can set
All right, in the next like 15 to 30 seconds, feel free to rotate to station 4 or 5.
Okay. We will have you report back, but head on over to the other side of the room. Oh, wait, we have something else?
Okay.
Okay, so just pick,
either groups 4 or 5.
4 or 5.
the online participants can use the QR code on the screen, and you can go on the Miro board, and you can pick a group together and just go into it, or you can do it in the chat box, whatever you prefer. Okay, so if everybody in the room could either pick what types of data or stories can drive momentum or move action forward, that's group 4. Or group 5, which MFBT components feel most viable or relevant in your context? That's why we handed out the guidance note, so you could see what the MFBT components are. And we will come back and hear what you wrote for 1, 2, and 3, after you do 4 and 5. I'm putting this here so we don't forget to announce. So you remember to announce. Okay. Group 4 and 5.
I got a picture.
4 and 5.
By the way.
Of what?
I got a picture of you.
Oh, thank you. Yeah.
I'll send you my picture. I'm sure I look great.
I think Christine took one too. How was your travel?
Easy breezy. I sleep.
Yeah, I did too. We were on Southwest. We actually didn't have a link. It wasn't as bad as here. Yeah.
I work.
Yeah. I'll be back.
Not really specific.
Bonnie, do you have any observations?
You're in Atlanta, then I want to be.
Not today. Yeah. We need to find a fund because we want to help them work with them.
I don't know.
You know, the pre sessions, I was telling them.
I'm interested. I'm actually interested in the one from Oklahoma State.
Yeah.
That's
So
one
I
of the
I mean, I have, but
No, I just opened it, that's why.
Even with this, like, what's relevant.
I'm not worried.
Yeah,
But I
it's okay,
think
that is
this
nothing.
first.
Yeah, yeah.
This first.
Yeah, yeah.
I have all the positions. I'm just gonna be done with it.
Oh, good. Well, I wrote down your sister and I wrote down yours. Where is your one?
I think it's the from inception to exit.
Oh, okay.
That's all about O&M.
Yeah.
It'll be fun.
Reading the books.
Yeah. And I have a poster of them. Actually related to my studies, so when I was looking at so I was generous.
So I think it's useful how that
So it's the project manager.
and not only just
She was going to, but she felt ill.
Oh, okay, I saw her put that in a, there's no room in the It's like, I didn't, I came about from a happy hour last year, and you weren't there, so you're not kidding. But it sounds so fun. Jen said that.
Oh, yeah, so she mentioned.
Barbara and her pieces.
Oh, and I just found out what happened.
Yeah, it's very fun.
I didn't notice it in this, but
Yes,
yeah.
you did.
I
I'll show you a
emailed her
picture that they
back.
sent,
Yeah.
or that someone sent in this chat. Both of you all will appreciate this.
Yeah, I think that's important.
Kind of risky.
So, Emily said she was in Bombay, and then they put these 5-foot signs, and this is the place that. So,
She's advertising. Please send that, will you send me that photo?
yes, and then Karen Levy was like, Karen said, the paths I use are almost as tall as me, aren't yours?
That's awesome. No, I want to be in that person.
Karen like a million times. She was on my committee. She's friends with Becca and Matt. She was at Emory Matt. She's at University of Washington.
I don't know.
Right, yeah, I mean, for me, I think that, I think that's a big difference, and I'd be curious if that's.
So how did you
In the stall, probably at
You know, I don't know that. I
I
met
had a
him
new,
through her.
well, I never met him,
Oh,
but,
okay.
I was here 2 years ago.
Yeah.
We wanted to find out CDC reviews our one of my team members found someone from CDC who worked on toilets but wasn't the right person, and he put me in touch with this guy Graham. And then Graham's team did
Yeah.
some in Kenya, and that's what we presented on last year. I wasn't here because I had back surgery, and then Graham is almost the same condition that there may be things. So, and then we were trying to call, and then Graham and myself in February, but everything got insane. And he stopped being
That's the same thing that's happening right now.
So we never had a group call, but an organized search happened.
Okay.
So, I mean, I messaged Graham and things every once in a while, like, how you doing? He hasn't been fired yet.
It is.
I think they're almost done? Another minute? Okay, are done or almost done? 30 seconds.
Excellent.
Okay, and then I'll let you do all the
Sure, I'll
feedback
just
in.
facilitate.
I would just check the mirror board. I don't think anyone.
I did.
Okay, nothing. Okay.
Not a thing.
Do we want to ask people to come up here? They were going to talk about their.
Oh, we have a
Here,
microphone.
take the mic for the people on Zoom. For those who are online, we are going to have the breakout group people report with holding a microphone, just in case you're still there and listening. Okay, over to you.
You all want to wrap up?
Yeah.
Head back to your seats?
Or do they need to buy their flip chart?
Or if you need to be by your flip chart, you're welcome to be. All right, I heard a lot of good chatter, so hopefully that means the discussion was fruitful. Anyone from group 1 want to share what you all discussed about what public toilet infrastructure currently exists in your context?
Who was in group 1?
Do anyone want to say?
Don't be shy.
Do we need the mic?
Yeah, but
Yeah, just so that people online can hear them.
Okay,
Did anybody?
I'll say something.
Yeah, go ahead.
We talked a lot about how private facilities have tools in them to sort of
stop you from using them. Like, timers at Starbucks that are announcing how long you've been in there. That's not something I've seen. So-
Where is
But
that?
maybe you can, will you share that?
Yeah, I live in the north side of Chicago, and the closest Starbucks to me has there's like a 15-minute digital timer that's right on the menu that lets you know who's been, like how long they've been in
And
there.
it has their name?
Not their name,
Okay.
but you just, as soon as you close the door, it starts timing you. So it's very stressful.
I mean, on one hand, I try to get it. On the other hand,
Yeah, I mean, it's nice if you're in line, you're like, okay, 15 more minutes is the max I have to wait, but yeah, that's the first time I've ever seen that.
wow.
What happens at the end of 15 minutes? Does the door open?
It doesn't open, but the Starbucks employees start knocking pretty aggressively.
Yeesh.
Yeah,
Okay.
so, but I've never seen what happens if someone doesn't get out at that time.
Would you like to give
I
a
think we
sample?
should do that. Noted.
The other thing we had a question about is what is the role of non-governmental organizations in this space? Because do you want to share what you shared about Kathmandu?
Yes, my name is Preeti and I'm from Water Nepal. So we have in Nepal, in Kathmandu, few public toilets that has been built with the funding of the NGOs while with collaboration with the local government, and they are very much user-friendly and menstrual-friendly. So, but otherwise, if I have to talk about the public toilets, most of the time we lack basic facilities. Forget about having menstrual health facilities. So that is what I discussed.
Anything else from group 1?
No.
That covers it? Okay, what about group 2? Who needs to be involved to spark or sustain interest related to MFPTs? Anybody from that group want to start us off?
I can start. We said women, so in the context of being a woman who menstruates, of being a girl who maybe doesn't know what that looks like, or a mother who's teaching a daughter what happens when you menstruate, or a teacher, or someone who cleans bathroom facilities, or basically anyone in that context. We also talk about men as fathers, brothers, teachers, policymakers, business owners. It's kind of a lot. It's, specific to people who menstruate, but also kind of everyone's business at the end of the day. We talked about NGOs and nonprofits and advocacy groups really pushing for this policy change and facility availability. And
The last thing that we also talked about was probably making the people who are actually having input on the design, so the engineering firms, but also the local governments, the schools, the other public spaces like libraries need to be involved in all of those talks and aspects. Yeah.
Great. Thank you all. And then we'll go to group 3. What are the political and economic barriers to getting started with this work? Anybody from group 3 want to start us off?
Hi everyone, Sophie Eucling from WaterAid. We discussed in terms of using the tool and who would be using the tool and what would be their incentives to use it, particularly if we're looking at governments in terms of generating this data, and then what's the implications of that in terms of the need to act. We also looked at whether the tool itself helps provide some guidance in terms of, well, once you've got this data, once you've got the information, what do you do with it? If it's to be used for advocacy, how do you identify the advocacy targets? We talked a lot about the potential for having this data and having the being able to raise awareness in terms of, I'll pass to you afterwards to talk about the having this information and data in the hands of girls who could also advocate with decision makers and how their voice can be heard. And let me hand over to you because you can speak to that point later.
Thank you. I'm Vivek. I'm also from Nepal, and we just had a Gen Z revolution. I think you must have heard about it. So suddenly the politicians are open to listening to voices of young girls and boys. So I think it has to become a commonplace thing. They should be able to have a kind of a easily adaptable kit. They can rate the publicly available toilets all around, and then they can go to their municipal governments. And now municipal governments have got what they call LISA indicators based on which they are rated, and they are I would say eligible to get extra grant from the federal government. So if it could become one of the indicators on which their performance is measured, then I think there is an incentive there as well. So it could be something that could be led by girls and adolescent people who are in school, and we already have some programs like adolescent-friendly municipalities, child-friendly, but I do not know till date there is anything on this. So if we could put in some indicators on this, then I think there would be both an incentive for politicians and the people who are affected most, they could raise their voices and make it a priority for the politicians.
Yeah, I love that idea. That's amazing. And one thing I wanted to note that I don't think that we were able to squeeze in much into our presentations today is that with Marnie's original project, they did key informant interviews that gave them a lot of great insights as far as stakeholders to engage in, and that's part of the toolkit, even though, so there's the quantitative piece and the qualitative piece. We did not do the qualitative piece in Atlanta, but I think those data provided you all such insight into maybe what's next and how you actually get to decision makers and start advocating. What about group 4? I know we kind of merged groups, but anybody want to talk to us about what types of data or stories could drive momentum? I think that really adds to the last points that we just heard.
Sure, so one of the things we talked about, I think, was with respect to pilots. Sometimes you don't always know immediately what the usage or cost data is going to look like, so once a pilot has taken place, making sure you have data on how much citizens are actually using the space, how much it costs for those implementers, so that when you take it back to other business owners or local policymakers, you have some evidence to kind of show what this would look like at scale after doing a pilot. And I think I would also add, we spoke a little bit to that accountability piece of just having a policy sometimes isn't enough, but making sure you communicate with the people on the ground that will actually have to implement the program, so the facility managers or the people in those spaces. Anyone else want to add more for group 4?
Great. And then to wrap up this part of our discussion, what about group 5? Which MFPT components feel most viable or relevant in your context?
So our group came from multiple different contexts. We generally urban and peri-urban contexts. So we were saying that first, disposal is really important. Having a container with a lid and with a bag, or in some contexts internationally they do incineration pits, so that's also an option. Not part of the MFPT components though, but we also said products, having pads and tampons available, and we then said hand washing, so soap and water, or if there's no water then hand sanitizer is also a viable option. And then we said privacy, so a door, a full-length door or a big enough door with a lock, or privacy. And then we were saying that we don't know if the mirror is always viable for our context or is not necessarily a priority for a lot of our work.
Yeah. Thank you all so much. Those I think make perfect sense. They're the things that are also very aligned with sanitation advocacy. And so, hitching our wagon to other advocates is always helpful, and especially when it's an issue that impacts more than just women, we often can get more momentum. So thank you all so much for participating in that discussion. I think now, if I can get our slides to work, we are going to move towards the menstruation on the move and talk more about advocacy.
Yeah. And one thing that just came through, and I think it's in our papers, to that point about allies, is when we were doing the interviews in New York City, because I did those with a team member, we heard from there's a law that bathrooms should be should address the needs, it's a federal law, I think, of those with sort of GI issues. And we had a community member who we interviewed. There's really strong community boards in New York City, which are great, but also keep a lot of toilets from being built because they don't want homeless folks in their neighborhoods. But this woman had really good points about, are you going to be an ally with the GI folks who need a disposal unit for ostomy bags? I don't know if everybody knows ostomy bags, but or are you going to be like competing with them for resources and have your own disposal? And I was like, oh my God, that's the last thing we want to do. But I just didn't think of that. So again, those key informant interviews really helped us to understand for our city the ways in which there might be allies that we should try and work with. And actually, New York City passed legislation, the city council, we'll see if anybody funds it, for a whole new toilet strategy for the city. And because we had been advocating and lobbying with city council members, they put in language to this bill that at least a percentage of them need to be menstrual friendly. Now, nobody knows what that actually looks like in New York City, but the fact that it was just that conversation and sharing and keeping them in the loop, inviting them to our feedback sessions, doing a webinar with them, that made them sort of appreciate that it was valuable and they should try. Bless you. Okay. So I'm going to dive into this because absolutely April's right. It's a great form of advocacy. But before I forget, and just in case any of you leave early, not that you would leave our session early, there's two events I wanted to flag. One is, and we have flyers, is in your handbook. For those of you who work globally as well, it's going to be about MHH, menstrual health and hygiene indicators for adolescent girls primarily. That is tomorrow, same time. Early morning, 8:30 to 10 in this room. Oh my God. Anyway, so just we have flyers if you want to see that. We'll be putting those around. And then what is not in your program, similarly, this is for folks who work globally, probably, although I think it's quite relevant as our MFBT study was. There's going to be a session that sort of thinks about how do we build a shared action sort of agenda, an advocacy agenda, to make sort of when the SDGs run out, how do we get menstrual health into the post-SDGs, presuming there still are post-SDGs framework. So that, again, not in your program, but we have flyers. It's tomorrow from 4:30 to 5:15. So just come get these if you want to, and we'll be handing them out. Okay, so back to this. Oh, great, we're having a little comment from Pakistan. Great. Using girl students as MHM advocates proved a very effective tool. That's great to know. So what our 6-city study did, it was actually, we were at UNC 2 years ago having lunch saying, how do we make this more compelling? And we thought, what about all the women who move around cities or folks who menstruate who move around cities and have to deal with toilets? So how can we capture, and my research separate from this project is often very anonymous story writing is a lot of the research I've done over 20 years. So we thought, let's try to collect folks' stories around how they manage their periods as they moved around cities, which for sure April should do in Atlanta. And you should, so just to remind people, I long ago came to appreciate that as important as rigorous, hard quantitative data is, storytelling is often actually what moves governments. We won't get into the good and bad of that, but just to say it's a very powerful way to put ideas in the world and to move people to do something. So the process is really simple. Finding people is a little tricky, but it's a very simple process. It's just collecting folks' anonymous stories on moving around an urban context or public space when they're menstruating. You can adapt the prompts we used. I'm going to show you a slide with our prompts. And then you just push it out. We emailed our networks. We put it on social media. Frankly, we did not have a lot of time or bandwidth to do much, but we got enough stories that we found it compelling and we had something to showcase, which was kind of our point. So I still think this is too long. Generally, when I do anonymous story writing, there's only 4 prompts, but we couldn't agree on what we wanted to include, not in a hostile way. We wanted to help people understand what we were trying to capture, which was, as you can see, so this is what people would read. They would click on the, they'd go on the QR code, they would go to this form, Qualtrics, I guess, and it was, I don't remember what it was, but please share your story of menstruating while moving around your city. This could be menstruating while touring, because we wouldn't necessarily just want to get citizens, like people who live there. We wanted to get maybe people visiting. shopping, walking around, commuting to work or school, or being out with families or family. In your story, please consider describing in detail any of the following in 500 words. So we knew what we were thinking about. We just weren't sure people would understand, which is why we put so many. How old were you? When did this experience take place? What happened? How did you feel? What were you doing when you had to manage your period? How and where did you manage it? Describe how easy or difficult it was, and sort of to access adequate toilet materials and why. Was access to a public toilet helpful versus in a store or restaurant? Why or why not? Did this situation affect the rest of your day? If so, how? Do you have any advice about this? So whenever I collect anonymous stories, I always have advice section at the end, because it's always interesting. That really tells you it's the people who need it solved. They always have the best ideas. So we collected these. I'll show you how we did it, but then we put on my team's website, we created a page for every city, because we did all 6 cities. Some of the cities, for example, the Japanese stories were collected in Japanese, not in English. So on our webpage, you have the Japanese version and the English version. I can't remember if we did that for Rio. We may have done that for Rio as well. I can't remember. And for Barcelona, we may have done that. But either way, the English is definitely there. So you go to our website, we have Menstruation on the Move stories, so that's what it looks like. And then like on a given page, you'll have the picture at the top, and then we just had a collection of the stories. We didn't put all of them in there, but it sort of pops out as quotes and gives people an idea. What made me really happy? Many things make me happy, but one of the things that made me happy, so just so you see, that's Rio, and that was a story of a 35-year-old woman, and then this was Osaka. This was a 28-year-old person who talked about having to buy pads at a convenience store. What was neat is when we posted this, we pushed it out. We have a listserv, Period Posse Presents listserv, and also LinkedIn. Is that the case for her, which many of you may know is a really active donor and advocate in this space for menstrual health. They created, because they're better at this than we are, they're not academics, they created this super cool little video thing. So when you were on their LinkedIn, I just screenshot it, when you were on their LinkedIn post, took me a while to find it because it was a while ago, and then they created this cool like flip thing, which I'm sure all of you know how to do because you're all younger than me, and then a comment was, if you ever want to do more cities, let me know. So of course I wrote to her. So just to say, I think it can take on a life of its own, and please go out there and do that better than we did it. Because I love my team, but none of us are comms people. And then the last slide is just kind of how do you get started. So one, think about how you want to disseminate the stories. Do you want to create a website? Do you want to do Instagram posts? Do you have some other mechanism by which you may want to share it out? How do you want to create the form? Google Sheet, Qualtrics. I don't remember what we did, but I can ask my younger, smarter team members. And then pushing it out to your networks, think about how you might want to do it. Student teams can help. What we did is we had these flyers just closest to me, which this was for New York only, and my students wandered around the city and like left it on subways and just put it places. We probably didn't reach that many people. But anyway, we did get a bunch of New York stories. And then we created this other sort of flyer thing, which, got translated into the cities that needed it in their language so they could push it out to their networks and so on. Anyway, so that's what we did. Happy to answer any questions afterwards. It's not audible. Mohammed, can you not hear us? Please let us know if you still can't hear us. Okay, so that's it. And then I'm not really sure, April and Anvesh, in terms of time, do you feel like we have time to do a little bit of this?
Yeah.
Okay.
We don't have
Alright.
anything after that.
Oh, right. Yeah.
Were the stories collected like recorded or written?
They were written. I think we offered a recording version, but I think they were all written.
So like people
'Cause we
wrote
thought-
them and sent them to you?
Yeah, they just typed it in like on their phone and submitted it.
Awesome.
So yeah.
Cool. Okay, so you all had a chance to kind of think through some of these initial questions, and we're hoping our outcome of this session is that we've convinced you all to go back to where you live and or where you work and to start some of this work. And so we wanted to just give you all a little bit of time to think about developing a starter kit, or at least the initial part of a starter kit. And so we want to spend some time just brainstorming some actions and initial steps that you might be able to take. So we have a little bit of time, less than we had planned for, but maybe about 10 minutes. And maybe we can divide into, three groups? Two groups?
Yeah.
Maybe just two groups, and you don't have to talk about one of these questions. You can you can pick one if you want, or you can just go through all three of them and just see kind of naturally where the conversation takes you. But let's spend about 10 minutes. Maybe we'll have one group that's up here in like the front right corner, and then another group that's like in the back left corner.
Actually, do you want to do groups, or do you want to work in
Oh, yeah,
pairs?
we could
Do you
also
wanna do
work all
pairs?
together.
Or in
Oh,
pairs,
sorry,
yeah.
pairs.
What do you, or do you, yeah, do you want to do it all together? What would you find most useful for our 10 minutes? All together? Oh, okay.
Let's do a working
You
group.
like each other. Go ahead.
Yeah, so we could just get started, maybe thinking about if people want to share how they would want to adapt the tool, how you might generate local buy-in, or what initial actions you might be able to take even with limited resources.
What are you going to do in Kathmandu, since we have two Nepalis in the room? Do you want a microphone? I don't know where the microphone.
I think someone back there has the
Is the
microphone.
microphone back there somewhere? Oh, yeah, just to put you on the spot.
Okay, so you mean like how do we look forward to adapting this?
Yeah, or what would you do if you decided to do it in Kathmandu?
All right, I think first we'll need to have it in a local language, probably. And I don't know, I'm not sure because if there is anything about the waste management in the MFPT, like how, if the toolkit also addresses about the menstrual waste management, if there's an option to that as well, maybe because that is a very big challenge right now we are facing in our country. And also would like to see if there is any monitoring indicators within the tool to ensure that to have a perspective from the users, whether it's how friendly it is for the users as well. Yeah, I mean like for now maybe that would like how I would like to see this, you know, maybe in a local language and what waste management options we have, and then if there are indicators in the toolkit for having the perspective from the users, how friendly they want it, yeah.
Yeah, and I'm so glad you brought that up. We actually debated a lot the waste management issue. We had a bit of an argument, but a friendly argument. I think it came up last year during the session. We did not include a lot on waste management because there wasn't time to really look at waste management in the cities, and that is so different in a New York City versus Kampala. But it pains me that we didn't include it because I know it's really important. So I'm really glad you said that. And that may be some additional work we also have to do to kind of make sure folks have, you know, guidance on how to add that on. And no, we don't have ourselves indicators on this right now, but that would be something great we could probably be working on. Yeah.
And while we have our representative from the government, you know, I've also written one of the questions is like, you know, just trying to understand like, you know, how this toolkit can be adapted to in our context, like what we are also talking right now, because you know, the institutional responsibilities for WASH and gender is fragmented, you know, across different ministries in our country. So in that case, you know, probably we have a government representative here as well, you know, so would like to know and like maybe yeah.
Thank you for putting me on this spot now.
That's what I'm here to do, and she's there to do it, yeah.
Talked about the majority of issues. What I feel is that, again, it has to be, like, you could put in a QR sticker outside public restrooms. When the girls go, they rate it. And there should be a kind of a online thing where you can, just, for example, you can go on a Google map and you can see different restaurants and other places. Maybe they should be able to put a rating there, and so that it spreads the word around. For example, you have got these fast food places which are frequented by young people, girls, let's say. And if they rate not just the food, but also the restroom that is available, I think that it creates some kind of incentive for those managers of the facilities, and then it improves. And the best way would be, they could, like in schools, they talk about the quality of the school and other things, but there is no way they can vent their frustration publicly about the poor quality of the bathroom facilities there. So I think some way in which you can put the manager of that facility on the spot, not us. I think that will create more accountability and they would be forced to improve the services and facilities in those public
Yeah.
restrooms.
And it might be, sorry, it might be you do what April did, which is there's audits of the government facilities, but also the commercial facilities. I think we should do that in Nepal. I think it's I love that idea.
Thank you.
I'll also add, in our Atlanta context, anytime we were going around, our students had little half sheets that they could give people if the business owners were interested in what their rating was, and we would provide them information on saying, you know, this is what the data shows about your toilet. We only had one person who was with Parks and Rec actually take us up on that offer, but we offered it in case people were interested.
Yeah.
Like, I'm still.
I see Nepal happening. Yes.
Toolkit, you know, I do see it talks about the accessibility of the person with disabilities as well, but just trying to understand, like, just to know, do we also have about the transgender advisory people? Like, is there any mention about that as well?
I don't remember, I think we say look at gender neutral toilets. I don't think we get more specifically because not everybody somebody may not identify as trans, but they may want a gender neutral toilet. So we don't get that level of specificity, but we make reference to if there is a gender neutral toilet to assess that along with, which I think you did as well, but I feel like I'm not answering your question.
Yeah, okay, and like, you know, if I have to talk in context of Nepal, like, you know, we have really come forward in terms of, you know, opening on this matter, you know, and there's also an argument sometimes, like when you talk about the gender-friendly toilet, like, you know, some people who do not want to identify their let you others know their identity, they would not be comfortable using the gender-friendly toilet, you know. Yeah, so just sharing that experience.
Yeah, I mean, in a perfect world, all toilets would be menstrual friendly and would have what folks need. And I've always admired that Nepal is, years ago, 2018 I was there, was way ahead of America. Now you're like light years out of America. But I think this is why you should adapt it to your context. Like what would work in Kathmandu would not be appropriate in Lagos, Nigeria right now, probably. So, yeah.
Thank you.
Anybody else have thoughts on adapting the tool, generating local buy-in? Any initial kind of low-hanging fruit that we can all do without resources in our current context?
Maybe not a low-hanging fruit, but one thing that would be great to get data on is in addition to the provision of menstrual products, whether they're for free or whether clients are paying for them. So beyond just stocking them, knowing if someone came in to use a truly public space, maybe the toilet is free, can they also access that product, or do they need to pay for that service specifically?
Yeah, that's great. And I think the toolkit asks that, which is great.
Yeah, if they're free or low cost or if we do. And the amount, I think.
Yeah, I think also it's really interesting to think about what types are available. Like, you know, people actually have preferences. And I think a lot of the times we see very low cost options that are not comfortable, that people don't want to use. And so even if they are there, maybe they're not actually being used. Any other final comments?
The final comment I would add is a bit of a charge to you all, if you have it. So I don't post a lot on LinkedIn. I just retweet what everybody else posts. But I was on Amtrak, which is, for those of you not from the US, you know, the main train line, the main train company, government funded, subsidized. And they have these brand new fancy trains. And I was riding on one and a few weeks ago, and I went into the bathroom, which I thought of when you talked about the ADA buttons not working, because it is so buttony, and I'm like, oh, these are gonna break in like a month. So everything, a button to go in, a button to lock, you have to wait for the button at the door, anyway, so. And so I just decided to assess the Amtrak bathroom. And it did have a long mirror, but they usually have mirrors. You know, it had everything, but it didn't have products. So I thought, okay, they just built these fancy things. They could put products. People pay a lot of money to take this train. It's not going to make them go broke, although Amtrak is always broke. And so I just was, you know, in an unusual move for me. I went back to my seat and tweeted and posted on LinkedIn about how I'm on this fancy new train and it's great, but it doesn't have menstrual products, and I put our guidance tool. And it didn't like break the internet by a long shot, but I got, I don't know, 80 tweets and, or not tweets, like likes, and people shared, and I thought, maybe one of those 80 people out there will actually start paying attention to the bathroom. So I think if each of you, when you go home to the city you live in, takes a photo or pays attention to one public toilet and makes a comment on LinkedIn and perhaps brings to light this absence, you can post our toolkit, you can post the photo, whatever it is to make people think about our toilets would be. You just don't know. It could really, it's like I really believe part of the reason we did the stories, and this thing is, you know, half the world menstruates and yet we don't have public spaces that are friendly for them. And so anything we can do to create conversation, I think is a valuable thing.
I'll add that we all know World Toilet Day is coming up in November, and so maybe we can push for menstrual-friendly toilets this World Toilet Day.
Oh, good idea.
Yeah. Any final comments before we kind of move to closing? Yeah, Christine? I think the mic's right behind you.
I think for the students that worked on the project with us, like now they never look at a bathroom the same. So even having the experience of doing the audit, next time you go somewhere, you're really thinking in a different way. And, you know, that's, I think, a good experience in itself.
Agreed.
Yeah. Well, thank you all so much for being here. I think we have just a few more slides to wrap up. What's next? I think this is a hodgepodge slide, but I'll take it. So please visit Marnie and her team's MFPT website to view and download the toolkit. In our Atlanta study, we used the toolkit, we used the training slides, and it was super helpful. We also reached out to Marnie's team and had them help us. I know Brandy relied on her team very heavily, so I highly recommend working with them and reaching out to them. It really made all the difference in our study. Keep thinking about opportunities to use this in your context, even if it's not the full toolkit or even if it's an adapted version like we did. And then I'll mention, as I said earlier, we have a poster session tomorrow where we'll have the Atlanta results, and that'll be just during the happy hour. And then Marnie, do you want to do your acknowledgement slide? Or
Yeah, it was a big team. We had some generous funding. That's what I will say.
yeah. And then I just wanted to also shout out our team. Christine and Brandy are in the room, but this is our team of students. I think we're missing one person, but these students spent a lot of hours just walking around the city and going into toilets and businesses and having conversations with people about why we were there. And like Christine said, they learned so much. And I think, you know, there was also some disgust involved, but I think a good opportunity for all of them. And with that, just want to thank you all for being here. I know we have a few minutes left, so if you all have questions or you want to come up and ask us questions, we have about 5 minutes until the session officially ends, so we can open up the opportunity for that. And then as Marnie has charged you all to check the Friday Center's bathrooms to see if they're menstrual friendly. We'll see if this year there are free products in the
So
bathrooms.
last year, if you were here, we put little flyers in the bathrooms to have people rate it. And I should have messaged them and we were like, are you gonna do better this year? But that would, you know.
Yeah, well, thank you all so much. I appreciate it.
So I finished here
On toilet stuff and she collects stories.
and then yeah, worked
But we did meet with her once, but I don't work here.
No, I worked at
I think you took pictures of them. Yeah, I think we could get rid of them.
Before I was with
Maybe it's a student project.
Or do any of these apps already say?
No.
Highly doubt. Which crosses over into the live stream.
Of course.